Chapter 6. Structures of the skin. Epidermis, outermost portion which is divided into thin layers called strata, composed entirely of epithelial cells, contains no blood vessels. Dermis, connective tissue portion of the cutaneous membrane, containing blood vessels, nerve endings, and glands. Epidermis, constantly lost through wear and tear. The cells must be nourished by capillaries in the underlying dermis. The stratum basale is the deepest layer of the epidermis. The cells in the stratum basale are constantly divided and producing new cells, then pushed upward towards the skin surface. The cytoplasm in these cells is replaced by a protein called keratin. Keratin thickens and protects the skin. By the time epidermal cells reach the surface, they are flat and keratinized. Stratum corneum is the uppermost layer. Stratum corneum contains the flattened and keratin cells. Stratum corneum is more prominent in thick skin. Melanin is produced by some cells. Melanin producing cells are called melanocytes. The dermis, framework of irregular connective tissue and well supplied with blood vessels, carries out skin vitals functions, contains most of the accessory structures. Dermal papillae extended upward into the dermis, ridges, commonly known as fingerprints, footprints. Adaptation often results from injury, helps protect against future injury, example, calluses. Subcutaneous layer, connective tissue membrane, hypodermis, superficial fascia, connects the skin to the underlying muscles. Areolar connective tissue and adipose tissue. Sebaceous gland, sac-like structure. Sebaceous gland is oil. Sebum lubricates and prevents drying. Vernix caseus is modified sebaceous glands. Sweat glands is sudoriferous glands with dermis and cutaneous tissue. Eccrine sweat glands are smaller and all over the skin to cool the body. Apocrine are mostly in the groin and armpits, become active during puberty. Ceruminous glands are in the ear, produce earwax. Ciliary glands are at the end of eyelids. Mammary glands are in the breast. Hair, composed mostly of keratin, is not living. Melanocytes add pigment to developing hair. Shaft is the visual portion. Root is below the skin. Nails, made of hardened keratin. The cuticle is an extension of the stratum corneum. Function of the integumentary system: protect against infection. Cells of the stratum corneum from a tight interlocking pattern resisting penetration. Antimicrobial properties of sebum and sweat: protect against infection. Protects from bacteria, toxic and harmful environmental chemicals. Protection against dehydration. Keratin and sebum help waterproof the skin. Prevent excessive water loss due to evaporation. Regulation of body temperature. To cool the body, the skin forms a large surface area for radiating heat to the surrounding area. When blood cells dilate, more blood is brought to the area so heat can dissipate. Collection of sensory information. Many of the reflexes that make it possible for humans to adjust themselves to the environment. Observations of the skin. Color. Melanin is the skin's main pigment, produced by melanocytes in the stratum germinativum of the epithelium. Hemoglobin, the pigment that carries oxygen in red blood cells. Flushing, diffuse redness caused by increased blood flow to the skin. Pallor, paleness of the skin caused by reduced blood flow. When circulation increases, so does skin redness. Keratin, skin pigment obtained by carrots and other red and yellow vegetables. Keratinemia, keratin accumulation in the blood. Bile pigments. A yellowish discoloration can be caused by excessive amounts of bile pigment, mainly bilirubin. Bile produced by the liver to aid in fat digestion. Jaundice, yellowing of the skin. Repair of the integument. Superficial wounds of only the epidermis do not bleed. Regardless of the injury cause, repairs with inflammation. Blood brings growth. Factors that promote the activity of restorative cells and agents that break down tissue debris and fight infection. Fibroblasts manufacture collagen and other substances to close the gap made by the wound. Stem cells of the stratum basale produce epidermal cells that migrate to cover the new connective tissue. If both the dermis and the epidermis are damaged, new epidermal tissue cannot be made and a skin graft may be needed. New connective tissue at the center of the healed wound is different tissue forming a cicatrix scar. Suturing the edges of a clean together decreases the amount of connective tissue, minimizing scarring. Excess collagen production in a scar can result in a keloid. Wound care. Water saline solution is best for cleansing. Harsher antiseptic can further damage tissue. Keeping a wound dry will promote formation of a scab. A scab slows healing and encourages scar formation. Factors that affect healing: nutrition, blood supply, infection, and age. Effects of aging on the integumentary system. With aging, the skin becomes thinner. Exposure to the UV radiation degrades collagen and elastic fibers. Circulation decreases, making them more prone to infection. Disorders of the integumentary system lesions. Any wound or local damage to tissue. Surface lesions. A surface lesion is often referred to as a rash. An eruption is a raised rash. Erythema. Skin redness. Macule is a spot that is neither raised or depressed, less than 1 centimeter in size. Example is freckles. A papule is a firm raised area less than 1 centimeter in size. A nodule is a firm raised area greater than 1 centimeter in size. A vesicle is a blister or a small fluid-filled sac less than 5 millimeters in size. A bulla, a blister or a small filled sac greater than 5 millimeters in size. A pustule is a pus-filled sac lesion less than 1 centimeter. May develop if vesicles become infected. Deeper lesions may be caused by trauma, can be followed by infection, require special care to prevent infection. Excoriation, a scratch to the skin. Laceration, a rough, jagged wound caused by tearing the skin. Ulcer, a sore associated with disintegration and tissue death. Fissure, cracks in the skin. Pressure ulcers, skin lesions that appear where the body rests on skin that covers bony projections. The pressure interrupts circulation, leading to ulceration and death of tissue. Other terms for pressure ulcer: decubitus ulcer, bed sore. Burns, caused by contact with hot objects, explosion, or hot liquid scalding, assessed by the depth of damage and percentage of the body surface. Superficial, only involves the epidermis. Skin is red and dry. Minimal pain. Superficial partial thickness involves the epidermis in both superficial and deeper regions of the dermis. May be blistered with a weeping surface. Second degree burn. Full thickness involves the full skin and sometimes subcutaneous tissues and underlying tissue as well. Third, fourth degree burns. Infection is a common complication of burn. Respiratory issues can result from smoke inhalations. Skin cancer, melanoma, is a malignant tumor of melanocytes. Basal cell and squamous cells, carcinomas, arise in the epidermis. Skin infections. Bacterial infections secondary to scratches of the skin. If infection spreads to the dermis, it is called cellulitis. Impetigo, acute contagious disease of staphylococcal origin, may be serious enough to cause death in newborns. Viral infections. Herpes simplex, formation of watery vesicles on the skin and mucous membranes. Shingles, same virus that causes chickenpox, follows the nerve pathways, producing small vesicular skin lesions on the nerve. Wart, verrucae, small benign tumor usually caused by HPV group. Fungal infections may cause surface infections of the skin. Tinea can be difficult to treat. Topical antifungal treatment may be effective, usually treated with oral antifungal meds. Inflammatory disorders affecting skin. Dermatitis is a skin inflammation. Acute inflammatory disorders. Urticaria, an allergic reaction characterized by the temporary appearance of elevated red patches called wheals. Acute eczematous dermatitis, intense scratching and skin inflammation. Scratching can lead to a secondary infection, can result from external irritants. Atopic dermatitis, recurrent bouts of eczema, may be subject to other allergic disorders. Smooth muscle, bladder, intestines, uterus, inside, contract wall of hollow organs, vessels, respiratory passageways. Tapered patient, each end, branching wall of hollow organs, vessels, respiratory passageways, branching networks, non-striated, involuntary, reduce peristalsis, contract and relaxes slowly. Cardiac muscles, wall of the heart, branching networks. Special membranes may sustain interrelated discs between cells, single nucleus, lightly. Striated involuntary, pumps blood out of the heart, self-excitatory, but influenced by nervous system and hormones. Skeletal muscles, attach bones, long and cylindricals, multinucleated, heavily striated, voluntary, produces movement at joints, stimulated by nervous system, contracts and relaxes rapidly. Nerve tail muscles, when to contract through neurotransmitters. Concentration, more positive on the outside and negative on the inside. Against is depolarization, moving things from outside the cell to the inside of the cell, making it less negative. Get rid of something positive inside the cell to make it negative on the inside. Repolarization, reestablishing the inside of the cell back to the negative. Sodium potassium pump quick reestablishes where sodium and potassium should be. Level out. Exchange will establish electrical gradient. Proteins move, open and close to let things through. Only cardiac muscles has intercalated discs. Muscles consist of fiber, single muscle cell, surrounded by endomysium. Fascicles, bundle of muscle cells surrounded by perimysium. Muscles, bundle of fascicles surrounded by epimysium. Tendon connecting muscle to bone. Sarcolemma. Muscle cell organelles. Sarcoplasm, cytoplasm. Sarcolemma, plasma membrane, T-tubules, extension of the sarcolemma. Myofibrils, specialized intracellular protein bundles. Satellite cells, stem cells. Motor unit, a single neuron in all the muscle fibers. It stimulates muscle fibers are scattered throughout muscles. Phosphates live inside the cell. Myosin, pyrophosphate, and goes from ADP to P. Calcium, extracellular interstitial. Parathyroid hormone break down, release calcium phosphate into extracellular. Sodium is 135 to 145, potassium 3.5 to 5.5, and calcium is 8.5 to 10.2, all in extracellular fluid. Borrow phosphates from creatinine. Quadriceps is the thigh area. Synergist muscles that work with quadriceps, flexing hips, and knee sartars. Quadriceps is the agonist. Hamstrings is the antagonist. Gastrocnemius is the agonist. Tibialis anterior muscles is the antagonist. The maxilla goes up and down. Superficial is on top. Deep is under superficial.